cannabinoids. So this is a perfect place here in Southern California to be able to highlight this great information about the future of blending natural plant-based medicine with our furry friends. So CBD for pets is a rapidly growing trend both with pet owners and popularity within the industry of CBD products. So I really hope that we up here can be able to share with you information to make this more palatable, as well as have healthy family members with our natural plant CBD-based products. My name is Keiko Beatty, and I'm actually here because I love animals. I don't think of them as animals. I think of them as something very close to my heart that I dearly hold as a wonderful thing that's added to my life. And my background is Ayurvedic, Chinese, and holistic medicine. But we have on the panel here some amazing people who have done many things to be able to assist in the expansion of the CBD and pet products. And so what I'm going to do is be able to share with them, or share with you, please have them say their name, a little bit about who they are, their background, and the companies that they have developed for pet products. So I'm going to start out with Ian Quinn. Ian, hello, thank you for coming and being here today. Tell us a little bit about you.
Hello, thank you for having me here. It's a pleasure, and I thank all of you guys for attending. So my name is Ian Quinn, veteran of the United States Air Force Reserve. I am CEO and founder of Phyto-Animal Health. We are exclusively focused on manufacturing products for animals and pets. However, we've recently included in becoming a vertically integrated company to be able to now provide white labeling services and human products as well. Our background and our tenets of our company are to help veterans and empower women and farmers. So I come strongly from a pharmaceutical medical device manufacturing background and strong connections in regulatory and working with the NAAC, the National Animal Supplement Council. I'm a board member for their hemp-derived CBD products and how we label them. And I work closely with the FDA and AFCO, the Animal Feed Control, to which we're working to actually get it to where we feed hemp seeds and protein to chickens and cattle. I'll try to bring some of that to the table and discuss today, and I'll leave the clinical and awesome information they guys have to the experts.
Thank you so much, Ian. And he didn't mention that right behind him is his partner in crime, Dante. And he looks like he's resting and sleeping right now. So we have Dr. Tim Hsu, who I met many years ago, and he is a veterinarian, and he has developed some great products, but he's very focused on education. So, Dr. Tim.
Hey, how you guys doing? My name is Dr. Tim Hsu. I'm a veterinarian, the founder and CEO of Vet CBD and Dr. Hsu's Pet Care. Prior to getting into the cannabis industry, I practiced in general emergency critical care medicine. The reason why I started a cannabis and hemp company for animals is because as healthcare practitioners, we really owe it to our clients and our patients to be able to explore all therapeutic avenues. Now, if cannabis has therapeutic benefits, then we really need to fully explore those potential benefits and be able to not just be able to provide the information to our clients, but also be able to provide the products so that way they can make the most informed healthcare decisions for their animals.
Thank you, Tim. And then we have next to him, Beth Frankenberg, Dr. Beth Frankenberg, who is also a veterinarian.
Thank you. Hi everyone. Yeah, call me Beth, please. I'm here as a cannabis advocate, not just for veterinary medicine, but for cannabis in general, because I'm not just a veterinarian, I'm also a medical cannabis patient, as well as a pet owner who uses CBD for one of my dogs. And I was also trained in the medical cannabis dispensary arena as a consultant and a bud tender. So I help human patients use cannabis to help their individual needs. So all these experiences have really kind of given me a broad view and kind of a perspective from many different angles in this industry. My personal journey began when I was probably about 5 or 6 years ago. I was injured in the line of duty, so to speak. I suffered from a cervical spinal injury, and I had to retire from veterinary practice, unfortunately. And I spent the next several years going through surgeries and medical treatments. And at the end of that road, I was faced with a lifetime of prescription drugs that kind of robbed me of my quality of life with my family and my like many people in that situation, I said, no way, there has to be an alternative, and that's why I turned to medical cannabis for myself, and it changed my life, and that's why I'm here. Once I had success, I resigned myself to learning everything I could, and started down this journey. And along the way, I've had the fortunate luck to meet some really influential people in this industry, and I work with them today. I work with several educational organizations, so I'm not on the product side, I really focus on education. And I work with a group called veterinariancannabis.org, as well as the Society of Cannabis Clinicians. They're focused on education. I also write a regular column for Cannabis MD called Ask a Vet about, obviously, issues that pertain to this industry. And I started about a little over a year ago, I started just an online resource for really anyone who wants to learn about cannabis and veterinary medicine. And you can go and you can find resources and tools to just help your own journey. So that's why I focus all my time on reading and writing so I can help further the cause, because I believe in it wholeheartedly.
Thank you, Beth. So we have some great panelists up here, and out of curiosity, how many of you here are pet owners? See, I knew we would have a target-rich environment, thank you. And so you obviously maybe came to learn for your own self and your family member, but how many of you are actually within the industry developing products or have a product for pets? Okay, thank you. Anyway, what I want to know, I think we should first start out with our panelists here. We have a lot of things that come up about dosing and how to help in dosing with your animals and pets, about what formulations to take that you find most beneficial, because it is different between cats and dogs too in what they can take. So, do you want to go ahead and start, Tim? The veterinary?
Yeah, sure. So in terms of dosing, it's a little bit tricky. It's not as straightforward as what we might see in some other medications. Even when we have, say antibiotics or pain medications, a lot of times we're dealing with a range of possible doses. Some medications can be anywhere from like 5 to 30 milligrams per kilogram, which is a really, really wide dose. Now, in terms of cannabis, generally what we do is we have the acronym class, go low and start slow. So that what that means is that you start at a lower level and gradually work your way up till you find the optimal therapeutic dose. And the reason why you do that is because you don't want to use way more than you have to and then end up using excessive product. And you don't want to use too little and end up leaving potential medical therapeutic benefits out there. And it differs. For example, we have epilepsy patients that are able to use a smaller dose, and then we also have some that are able to use it at just once a day to adequately control their seizures. And then we have other patients that may need to use it 2 or 3 times a day at a higher dose to control their seizures. And these patients may be the same 70-pound golden retrievers. It just varies patient to patient. Part of that is because we have what's called genetic polymorphisms when it comes to the endocannabinoid system. So the endocannabinoid system is why all of this works, because the cannabinoids interact with the CB1, CB2 receptors, and a lot of other receptors that are found throughout the body. But not all of these receptors are going to be coded exactly the same from person to person or from pet to pet. There are going to be genetic differences. So that's why if you take CBD, it may affect you differently than if the person's taking it next to you. It may affect them differently. So there are slight differences. And so for every patient, what we do is we provide a range. And we say start at a lower level and gradually work your way up till you find the optimal therapeutic dose.
Now, with a lot of pet products, I'm finding a lot of people are utilizing regular human consumption CBD products and utilizing with their animals. Do you think that's a suggested thing to do that?
That's kind of a loaded question.
Yes.
I think when you're using any medication on your pet, you need to make sure that it's safe for pets, because there are plenty of whether it's cannabis or CBD derived, there are plenty of products out there that are safe for pets, but there are some that are not, and that's why it's really important to know exactly what's in any product, not only the active ingredients, but the inactive ingredients as well, because we add a lot of flavors and additives to human products to make them taste good, but some of those are extremely toxic to animals, things like sweeteners, like xylitol, or, everyone is familiar with the chocolates and the candy bars that may have raisins or macadamia nuts in them, and they're fine for us, but if you give a little piece to your dog, that could be kind of a big problem. So it's really important when you're vetting any product, ideally if you can find something that's made specifically for pets, that's going to be more likely to be safe. But, there are products that are okay to give pets, and I always kind of tell people, go for the minimalist, go for products if you're using a tincture, say, that just has your cannabis oil in the vehicle and not a whole bunch of other stuff, The simpler the product, the more likely you can attribute your results or your adverse reactions to the active ingredient and not something else that's in there.
Thank you.
That makes sense.
Now, Ian, you have Phyto Animal Health. You have some products here, and I understand they're actually human grade, where we can consume them. I mean, what kind of formulation did you first start out in developing those products then?
Sure. So, kind of like what Dr. Beth was saying, we have to start taking a look at what are the ingredients, not just the concentrations of the cannabinoids, but the other ingredients, right? The co-ingestibles, as we call them. She mentioned xylitol, that's a sweetener. Humans, we like to buy those mango-flavored and watermelon-flavored type tinctures. It's not beneficial to an animal. Quite frankly, it's not beneficial for us either, right? We're mammals, we're two-legged versions, right? We breathe the same air, we breathe the same blood. pHs are pretty much the same in blood as well, so it's quite interesting. So before I got into this and utilizing products, right, I started with myself because I'm a veteran with traumatic brain injury and PTSD and helping other veterans. But it didn't mean I could take the same products and give them to Dante, right? And that's where my board of clinical advisors came in and helped us formulate these products and make sure that what was going to be added into it wasn't going to hurt my best friend, right? And so we started out with an edible. And that edible is nice. The challenge with edibles, and I think this is an industry-wide thing, is getting the same concentration per piece, but also then the delivery of concentrated amount of cannabinoids you need for pharmaceutical or medical benefit, right? These treats are 4, 5, 8 milligrams maybe is what I see. And that's not really enough for a guy like Dante who has osteoarthritis, right? Bone-on-bone arthritis. Based on the Cornell University clinical data, they state to use 2 milligrams per kilogram for geriatric dogs with osteoarthritis. So at least now we're starting to get some of that clinical guidance as to where we're going. And so it turns out that a tincture, or actually an oral concentrate, is a better application for my buddy here in the larger breeds. What a human can have is different than what an animal can have, but if it's in the cannabinoids, so to speak, if it works for them, it's going to be okay for us. Right? Again, there are no terpene profiles I've seen for animals that will hurt a human, but I've certainly seen terpene and ingredient labels on the human side that will damage an animal. So to Beth's point, yeah, if you can find a veterinary formulated and focused program, a product like Vet CBD from Dr. Shu or myself from Phyto Animal Health. Something to say about the market too real quick is understand I don't see competitors, right? Dr. Tim is a wonderful physician and has a great product. I see him as a companion in this space. And that's critical that we get that out in the open because we are all here trying to improve how this works. Right? Having talks like this, collaborating, working together is critical, and throwing mud at each other isn't going to help. Know that the people who throw mud and do all that type of stuff are not the players you want to be integrated with. They're not going to be here for the long term. The people who follow the standards, have good ingredients, good manufacturing practices, good agricultural practices. They're starting from a pinpoint of, I want to do what's right, not I want to make money. It turns out when you do it right, you make a hell of a lot of money.
Thank you. And now here's one thing that we talked about when you're talking about other people in the industry. With veterinarians, I know some of you maybe have approached your own veterinarian about using natural plant-based medicine products. Tim, what do you feel about other veterinarians? Is there a big call for them to have more desire for education?
Yeah, absolutely. The reality is that we're just scratching the surface right now in terms of the endocannabinoid system and having a good understanding of the endocannabinoid system and where cannabis is as a therapeutic modality. Things are still very, very, very early stage. When you think about the discovery of the endocannabinoid system as having only been discovered in the early 90s, you can basically kind of equate it as if we had just discovered the endocrine system, which is in charge of producing, regulating hormones. Imagine if you went to your physician nowadays and you said, hey doc, I want to learn a little bit more about the endocrine system. I want to know what hormones do. What is estrogen? What is progesterone? What's insulin? And if your doctor said, I don't know anything about that, You think that was pretty crazy, but that's where we're at right now, is that when we go to our physicians and we go to our veterinarians, we're talking to them and saying, what's this about the endocannabinoid system, the CB1 mutations, and anandamide levels, 2AG levels. Most of them will say, I don't know anything about that. And that's how early stage things are. So education is the biggest challenge that we face in the cannabis or the hemp industry. For us, we worked heavily on AB 2215 last year, which got passed into law as in January 1st of this year. You guys are allowed to talk to your veterinarians about cannabis, and they are allowed to discuss cannabis with you openly and freely without facing any sort of fines, penalties, revocation of their licenses. That's great to see California take the lead on that. We're going to be working on something on a national level for next year, because my goal is to be able to fully integrate cannabinoid therapeutics with veterinary medicine and allow veterinarians to be able to openly and freely discuss cannabis the way their physician counterparts are. We've got some other bills that we're working on in the California legislature next year as well. So lots of good things to come, but what I always encourage people to do is talk to their veterinarians about it, because the veterinarians really need to see that their clients are having these questions and they want more information. So when we ask the veterinarians, they're going to really push for change on their end and talk to the regulatory bodies about being able to have this conversation across the board.
Thank you, Jim.
Acronym, that's easy for people to remember, and the acronym is PAINS. So PAINS, and what that stands for is pain, anxiety, inflammation, nausea, and seizures. So in terms of pain, the biggest thing that we use it for are chronic pain. So a lot of times when we're dealing with chronic pain, we're talking about arthritis. A lot of the current treatments out there for chronic pain are less than ideal. A lot of people tend to use opioids for chronic pain, but opioids are not ideal for chronic pain. Great for acute pain, not so much for chronic pain. NSAIDs, they carry their own risk with it, organ damage, GI ulceration, things like that. But what we've found over the years is that cannabis can be actually really, really good for chronic pain management. Anxiety disorders, especially separation anxiety, noise anxiety, animals have anxiety just like with people. Inflammatory conditions, we've seen some really remarkable improvement in patients that have skin allergies, for example, and we're also looking at potentially using it for autoimmune disorders. Nausea, appetite loss. The CBD, THC are great for nausea control and appetite loss. CBD, not so much for appetite stimulation. CBD can potentially have appetite suppressing effects, but THC definitely good for appetite stimulation. And then also seizure control. So we've seen a lot of patients benefit for using cannabis to not only decrease the frequency of seizures that they're having, but also the intensity of the seizures. Now, the big question a lot of people have is the big C word, cancer. There's a lot of anecdotal evidence out there where people say, I use this cannabis and it helped me with this kind of cancer. We've seen some interesting anecdotal cases in animals also, but really there's a lack of clinical studies out there that have shown benefit for cannabis for specific cancers. Now, the big difficulty with studying cancer is that you have hundreds of different types of cancers. And then, even if you're looking at lymphoma, you're looking at B-type lymphoma, T-type lymphoma. And so it affects patients differently. So, say we're looking at, pancreatic cancer. Are we going to do a 1:1:1 ratio of CBD to THC of CBG at, 0.1 mg per kg twice a day, 1 mg per kg 3 times a day? You multiply all those permutations and you're getting hundreds of thousands, if not millions of different combinations. So cancer, while there is some really great promising preclinical evidence, we don't have the clinical studies that we need to be able to say one way or another, how we're going to be able to effectively utilize cannabis for cancer. But everything's still very, very early stages, like I said before. And just, Beth touched on this earlier, Dr. Beth touched on this earlier, but we do utilize THC in animals. It absolutely can be utilized in animals. It's the matter of dosing and formulation that makes it safe and effective. Too much of anything can be harmful. Certainly too much THC can be harmful. Too much salt can be harmful. This is why when you're stranded out at sea, you don't drink the seawater because it's way too much salt. It'll kill you. Too much water can actually be helpful. It's a condition called hyponatremia. So it's really about judicious use of it and dosing it and formulating it appropriately.
Here's one thing. We are looking at patients who can't communicate with us, how they're feeling, if they're feeling better from this. What do you suggest a person should do? Should they journal? Should they, as well as, talking with their veterinarian, what could they do to make sure what they are sharing with their furry family member is being beneficial?
Journaling is a great idea, and some of the clinicians that I work with really try and enforce the issue, because sometimes, with cannabis products, you're not seeing a quick night and day reaction. You're not flipping a switch. Sometimes you have to try and identify trends, and it can be hard, especially when you have multiple family members. I feed the dog in the morning, but my husband feeds the dog at night, and then you don't know, or if you're medicating. So it really helps to write everything down, right? And just simple things. How's your appetite? Any vomiting? Any diarrhea? What's the pain level like? Is my cat happy today, or is it kind of miserable? Because that can really be, from a clinical perspective, help you say, this is really helping, or maybe I thought it was helping, but when I look at this data, it's not helping as much as I thought. And that can help you not only gauge the progress, but if you need to make changes to your therapeutic regimen. So it's something that a lot of clinicians are really jumping on board with. Keep a journal, and especially in seizure patients, that's extremely important, because those patients are so hard to manage as it is that you really have to write everything down. Unless you're with them 24 hours a day, if there's usually more than one person involved in their care.
And as pet owners and as a manufacturer, that's the best advice, is journal, right? Let's say from my point as a manufacturer, right, and as a pet owner, I'm both. So as an NASC member, when a product causes any harm, even if it's just diarrhea or vomiting, we have to report it to the NASC. They actually have an adverse reporting system that if it's vomiting, diarrhea, it had to go to the hospital, whatever, you got to call and report it, right? So here I am, I got a customer who calls me and says, Ian, I love the product. She's been using it for her blind dog who's got horrible anxiety. He's 14 years old and walks like Frankenstein, so they got horrible arthritis too. And 12 hours later, the next day, the dog's running around having a great time. But then like 3 weeks later, she calls me in tears. I had to go to the vet in an emergency hospital. My dog started having diarrhea and vomiting. And oh my God, it must have been the CBD. That's what the emergency clinic said. It might have been that THC. And I was like, oh God, here we go. And I was like, all right, I'm going to have to call the NARS and I have to fill this report out. Oh, great. Now, mind you, there's like 5 million of these products have been sold over the last few years, and there's less than 100 adverse reported events, okay, in the system. Now, the good news is, I go to report it, and I did report it, but then the client comes back and she goes, Ian, I think it may have been the food that was recalled. I was like, oh, no shit, huh? But thankfully, she had recorded not just what she was given. She was recording what food she had, when she was feeding it, how much she was given, even what the temperature and the pressure was in the air at the day. That's amazing, thank God, right? Because it actually helped me go, oh my God, am I hurting animals? Because I'm that guy, no way, it's not going to happen, not under my watch. If I can't give it to a dog, I can't give it to an animal or a kid, no way, it's not going to happen. Now, as a pet owner, how much more relief was that for her, right? That she nailed it down. She was like, you know what, it was that food that got recalled because my dog is having issues again and I want to put it back on your product. Your magic oil is what she would call it, right? And she got back onto it, right? And so that was really critical for her standpoint, but also me as a manufacturer. But then also go back to her clinician and be like, hey, guess what? It wasn't the THC. Right.
Thank you. Well, we're getting close to the end of our time. I know some of you may have some questions, but I'd like to go ahead and give our panelists here something that they want to be able to leave our wonderful guests here thinking about their pets for the future and their better health. So Elizabeth or Beth?
Sure. Gosh, I guess if you leave here with anything, if you're planning on using CBD or any type of cannabis product for your pet, of course, always talk to your veterinarian, but there's a wide range of responses you're going to get depending on your vet's comfort level, right? There are some vets that still aren't really comfortable talking about it. So I think it would really help if you have a condition that you're looking to treat or you just have general questions, do some due diligence on your own, print out an article and say, I want to treat my pet's anxiety, I'd like to use CBD. You can find articles on that, just print one up. And if your vet gives you that kind of respond, you can say, well, if you're not comfortable, I did some research on my own, perhaps you could read this and then maybe give me a call. So kind of start that discussion in a respectful way, because there's a lot of learning that needs to be done on both sides, you know, and some vets are okay with it and some vets are still not. Hopefully that's changing, but there's a lot of work that needs to be done on both sides. And if, regardless of what you do, it's important to have that open discussion with your veterinarian. So, you know, do your homework.
Thank you, Deb. And Tim?
Yeah, I echo what Beth says, is that, talk to your veterinarian, have open conversations with your veterinarian. When I first started producing cannabis products for animals in 2015, a lot of veterinarians thought it was a crazy idea. Fast forward to today, veterinarians can't get enough information about it. The reality is that the only way to move forward in the cannabis space or the hemp space is by the integration of this industry with the medical industry. They are not going to be separate. Your veterinarian, your physician has to be able to comfortably talk to you about cannabinoids, about cannabinoid therapeutics and how it impacts your system. Have that open dialogue with them. If they have questions, we're here for them. I do have a 1.5-hour continuing education race approved webinar that I give to veterinarians throughout California. I'm more than happy to talk to them about it if they ever have any questions. We have a team of veterinary nurses on staff. If you guys ever have any questions, call us. I call pet owners back all the time just to talk to them and provide them information. More than happy to do so. This industry is so early stages, and it's one of the most exciting things that we see in our lifetimes. This is an opportunity that goes beyond our lifetime, our parents or grandparents' generations. Quite frankly, human civilization has never seen an industry develop at this scale. It's a CPG industry developing at a tech industry pace, and it's so fascinating to be a part of it. And you guys as consumers, as manufacturers, producers are also a part of it. Just have that open dialogue, because again, we're still so early stages. We're just starting to scratch the surface of things.
Thank you, Tim. And Ian?
Yeah, absolutely agree with Dr. Tim and Dr. Beth. We're all here because we're advocates. We, either from personal anecdotal evidence and experience, or from others that we love, our animals or our mom or our little sister. We all have that. That's why we're here. That advocacy is not just because I want to use it, I want other people to use it. That means, as he said, Dr. Tim said, future generations. I've got children, right? And I need to know that we're going to be passing down a beautiful planet to them, right? And the only way we're going to do that is actually being the advocates that we are with the consumers, with the medical professionals, with the manufacturers, and with the regulators. I mentioned earlier the FAA. Who's here flown on a plane? Right? Okay, all of us, I'm assuming, right? If you've flown on a plane, and you actually used to fly on a plane back in the 60s, it's a different world. It's a totally different world. In fact, there were so many missed airline crashes that the FAA was born. Right? The government actually came in and said, you know what, we're manufacturing too many planes. We have too many planes in the sky. We need to stop manufacturing these planes, and we need to stop having so many planes in the sky. And all the consumers and all the manufacturers were like, whoa. If you do that, you're going to screw everything up. So as you would imagine, the pilots' unions, right? The flight attendants' unions and all these other unions in the airports and all that started showing up, right? The consumers started showing up to these meetings. And the government, if we do this by ourselves, we're going to screw it up. And it's not going to be good for them, it's not going to be good for us. It's essentially what led to the regulatory bodies that we have for the airlines, right? We need to be that involved as well. Not just let the government run rampant with it, because then the FDA sends out stupid letters that say that CBD is toxic, we don't have enough data. But then the World Health Organization says opposite, and the NCIA says opposite. And then the European Food Administration comes out and says the opposite. So who's right? Well, that's up to us to gather that data, to when the FDA has their open meetings and tells people come in, show up. We need you guys there. Write your letters to your statesmen, to your congressmen. Support assembly bills like Dr. Tim was pushing, AB 2215. You have to be the advocate. And I need your help as a manufacturer. They need your help as clinicians. Because let's think about it like this. One of the things we hadn't talked about yet, he brought up opiates, right? Dr. Tim did? Well, the FDA asked us to cut back opiate manufacturing, right? Because we have an opiate epidemic that's killing people left and right. The same guys that make opiates for humans make them for animals. So when they say cut 50% of it, 80% of the cut goes to the animal side. How do these guys manage pain in their hospitals then? It is inhumane and unethical not to let them use these cannabinoids and these molecules in their practice or with their patients, right? It's not right. You can't let these animals live in pain. The flip side to that too is you're messing with their business model. These are professionals who have to pay bills too and have families. And unfortunately, we've actually seen a rise in suicide rates in the veterinary profession. A lot of it actually in the female veterinary profession, right? These are concerns to me because, see, I got into this helping veterans. We have a suicide rate of 22 a day killing themselves. Farmers are 44 a day, okay? And the rate for female veterans is increasing too at a rate that we have now an obligation to help them with, right? Because if my patient's in pain and I can help them, shouldn't I be able to sell that product too and make money? Because I sell glucosamine, I sell all the pharmaceuticals. Now you're impacting my business and my ability to keep my doors open. That's another lawsuit too that the government is facing. So look at all the different ways we can really have an impact, right? Not just for us, not just for our loved ones and our pets, but really for those generations moving forward from us. This is critical, right? If our farmers can get back to doing it right, because they've got the advocacy, they've got the researchers, the people coming in to help them, it's big. Right? 34 a day are having an issue. If you look at what happened in Oregon just this last harvest season, we had 7 farmers in Oregon kill themselves because their crops rotted. They didn't know they couldn't water, that they had to water the root systems, that they couldn't fly over and water from above. Because when you water from above, it gets in the flour. It gets in the flour, it molds, it drops. Or if it's cold, it freezes. You know, so you have to help. You have to educate. And you know, you're going to run across, you know, that uncle who's just crazy at Thanksgiving, that Christmas. It's all right. Be patient. Be calm. Come from a point of how can I help them feel safe with this knowledge? How can I help them feel safe enough to connect with it? Because once they connect with it and they feel safe, they're going to use it, they're going to share it. And then they're going to fall in love with it. And then they'll not ever let it go. So that's my 2 cents.
Thank you, Ian. I know one thing, many of us are here because we have a loved one in our family that we care about, and they can't communicate with us. But we do hope that these amazing panelists gave you information to create more love in your life. So I want to put our hands together to our panelists. And we have maybe just time for a couple of questions. Oh, okay, yes, all right, sir.
So, I have thought it was not it's actually going to survive. You know, it shakes for hours on end, and January 1st is coming up. So, what kind of dosage can I do here? More anxiety for a 40-pound dog, but what can I do here?
Have you tried any products before?
Yes, but the quality of the products is available all the time. So,
Yeah, because you know, 2 things is you know, whatever product you use, you know, if it's in the license market, then you know it's you know, COA tested. If it's on the hemp side of things, you want to make sure it's a quality product so that way you know what you're giving is actually has cannabinoids in it. But you know, generally go a little sort of slow. You know, start at a lower level and gradually increase it. You know, for us, we utilize THC. We love THC because it has great therapeutic benefits, but it's also part of the entourage effect. The entourage effect states that using multiple cannabinoids together actually provides greater therapeutic benefit than using individual cannabinoids as an isolate form. So my recommendation is if you use a full spectrum product, start at a lower dose and gradually increase it until you're able to find the therapeutic benefits.
what should I start at?
What's that?
What should I start at?
Which dose should you start at? It depends on the product, because you know, for us, for our 20 to 1, which means 20 parts THC, 20 parts CBD to 1 part THC, we generally start at 0.25 milligrams per kilogram. But we have a dosing guide on the product to help guide the patient or the client. And then if you have any questions, you can always call us. But whichever product you use, they should be able to provide a dosing guideline on the product.
Something else just to throw in there is consistency. Are you using it on a daily basis with your pet?
Well, it's going to have to start on a daily basis coming up, you know, absolutely, because she freaks out under any noise, really. We have a lot of gunshots in my neighborhood, and a lot of noise makes her freak out. The fireworks right in Hawaii.
So consistency is going to be important, right? And then noticing, okay, metabolic rates, right? So making sure a few hours prior to, let's say, the holiday coming up, fireworks and stuff are going to be going off. So then also looking at some behavioral modification applications, right? You can't just think that CBD is going to be a cure-all, right? That's going to be the thing. Using in combination with other behavioral modifications, let's say making sure they have a room where it can be quiet, maybe even the closet with their bed and somewhere they feel secure. Like Dante here, he hates fireworks. My 14-year-old Akita Pitbull, he's today, even with CBD, he still gets up and walks and goes and sleeps in the bathtub. So making it a comfortable area, making sure they've all got their collars on, they've got their ID chips, right, just in case they run away, they can quickly, so I think using both, staying consistent, but looking at that behavior modification will also help too.
Okay, great.
Yeah, there's board-certified behavioral therapists that are veterinarians too, so that's a really good recommendation.
We hope the best for your pet.
So to build on that question, how far in advance of the traumatic event do you recommend to keep dosage? Like a couple hours before we know the fireworks are going to happen, higher dose that morning so that it's longer the effects? In general, what do you see as most beneficial?
Are you talking about just the situational anxiety?
Right, so 4th of July, maybe the fireworks, if I know my neighbors are going to go crazy like they do every year, 3 hours before the expected time, is that when it should start, or that morning?
And there's different schools of thought on that because, say around 4th of July, usually there are some pet owners that will start dosing a week before to kind of build it up in their pet system, and then that night is going to be really, really tough. There are some clinicians that say for like a stressful event in the hospital, like getting a nail trim, they'll use a short acute dose of a CBD isolate, say an hour beforehand. But every pet is different, and some pets know. They know a week before, they know that things are happening, and you can see their anxiety levels starting to rise. If it's a chronic condition, it's easier to keep them on it. And sometimes things happen and you don't anticipate them running if you have that problem as well. But it may be worth doing all of it at a time.
Okay.
Thank you so much. We actually do have to wrap this up, but I do know that they'll be available outside for questions if you like. And again, I know we're all here because we have someone we care about, and we cared about that you were here with us today. So thank you again so much to our Thank you again everyone here at the CBD Expo West. And we have another panel coming up soon, so articles about this. You must get a lot of inquiries from other veterinarians. What are some of the key things that they're asking you?
Sure. May I ask a question?
Yes.
Are there any veterinary professionals in the room?
Okay, you're good. You're safe.
Well, no, I was hoping there were. But so you're asking what veterinarians are asking?
Yes.
Veterinarians are slowly starting to accept, cannabinoid medicine in its entirety. It's something that's, human physicians have had access to and been able to discuss for a long time. We are so far behind the law. We're about 20 years behind the physicians. And there is a really rapidly gaining momentum within the veterinary profession. If you go to any veterinary conference any time of the year, the few cannabis lectures are standing room only. So veterinarians really, really want to know this information. There's just not a lot of information out there yet. It's not taught in veterinary schools, just like it's not taught in most medical schools. So we really have a lot of work to do. I think that's probably one of the greatest barriers to this industry is the education of veterinarians, because there are still so many out there that think that THC is toxic and that there's no potential applications for cannabis at all in pets, and that's just not true. We all have the same physiologic system, and so we should be able to manipulate it and use it to help solve some of these problems that we don't have really good traditional medical therapies for. So veterinarians are generally, when I speak with them, they tend to ask the basics, just which sometimes just floors me, like the very, very basics. But I'm glad to see people asking questions because that's going to propel this industry. So the more interest there is, the more we're going to help each other learn.
So as we know, a lot of our audience here are pet owners. It's almost they have to be their own advocate for their individual furry family member here. In that, where are some good sources that they can go to if their vet doesn't have that clinical background in utilizing plant-based medicine? Where can they go to find information to help with that? I mean, that's something.
There are resources out there, absolutely. And you have to, most veterinarians have to be willing to look and do that legwork on their own. I mean, that's kind of why I started my website, because people at least have a place to go for links to other resources, and pet owners and veterinarians are interested. In fact, I think between the two, the pet owners are largely driving this industry by far. I mean, we're not here because a bunch of vets got together and said, hey, let's start using cannabis. You know, that's just not what's going on. But, you know, the consumers and the pet owners are demanding that they be able to utilize this medicine for their pets because they've seen it work for their friends, their family members, and whatnot. So there are some of the resources I list on my website are places to go to, you know, take a webinar, read a book, read an article. You can go, you know, if you're truly interested in veterinary applications, you can go as a guest to a veterinary conference. You can Google, and Dr. Shu, I think he has done a 1-hour webinar on the basics of cannabis. So there are resources out there for pet owners and for veterinarians. Veterinariancannabis.org is a great resource too. And then doesn't have to specifically be veterinary gear. There are some wonderful websites. ProjectCBD.org, if anybody's ever been on that website, has amazing information. So if you're really interested in learning, check that out.
Thank you. Well, one thing, of course, we want to look at regulations coming up, what, as Tim was saying, some of the things that are passed in the bill, but it's because of the efficacy and the testing of it. I mean, Tim and Ian, I know you have products here. What did you do in being able to develop products that you knew were safe for our furry family members?
Yeah, so for VetCBD, which is our cannabis line, we go through the licensed California regulatory system, which means that every single batch of product that we produce has to be tested by a state laboratory. It has to be quarantined, it has to be sampled by a lab technician, and it gets tested for potency to make sure that whatever is on the label is actually what's in the product. It gets tested for pesticides, solvents, microbials, mycotoxins, and heavy metals, and that's every single batch that gets produced. The cannabis that's tested in California through the license system is tested to far higher standards than the food that you eat. In California, we love to over-regulate. We've certainly done that with testing as well. So what we did with our hemp side of things is we've done the exact same model. On the hemp side of things, hemp companies are under no obligation to do any sort of regulatory testing. So that's why you've seen the articles come out with a lot of hemp products that are mislabeled. Essentially what happens is that you may have a product claimed to be 100 milligrams, but in reality it could be 50 or 75 or in some cases 0 milligrams. And so what we've done is mirror that exact same model, is that we use a state licensed California laboratory to test every single batch of our hemp products for potency, pesticide, solvents, microbials, mycotoxins, and heavy metals.
Thank you so much. Now, with these products then and developing them, you want to look at different standards of packaging. So Ian, can you suggest that a buyer who's looking for something for their pet look for on a package, because you have wonderful packaging?
Thank you. The first thing we want to look for is what is the actual ingredients, right? What's my dose per serving? And then we want to see, is there anything on my label that is going to direct me to third-party test results? Typically this will be done in a QR code. So like with Vital Animal Health, like Dr. Tim was talking about, every batch that we have is put through a full panel certificate of analysis from a third party. That then is created with a QR code that then goes onto the label. That label then, when the customers are in the store or when they purchase it, they can then third party verify what the serving is per ml as to what the laboratory test is. That way you do know exactly what you're getting, because as you read the report, you'll see that a good majority of the products out there, especially on Amazon, there's a reason they say they sell hemp oil and not CBD. Because then you take the tests, they don't have anything in it. Because there is a difference between the ingredients, right? You have your certified grass ingredients, right? Hemp seed oil, protein, hemp hearts. Who here eats hemp hearts? I love them, I think they're tasty. I'm working with the animal feed control to say that we should feed those back to chickens and cattle. You'll have better omega-3 in the eggs and in the meat, right? As well as in the dairy cows and their milk. But then you got your phytocannabinoids, and then you got your pharmaceuticals, right? That's what the FDA is going to protect. Food for animals and humans and the drugs. That's why I've been working with companies that are also members of the National Animal Supplement Council, NASC. If you go into any pet store and you look at high quality supplements, you'll see that they have a logo called NASC. NASC overlooks how we quality control supplements for animals, right? Actually, supplements for animals are even more highly regulated than human products, right? When's the last time and cannabis and hemp-based products for animals are even more regulated than the other ones. Because what's the last time you picked up a bottle of glucosamine chondroitin and it had a QR code that directed you to a COA? Never, right? Have you seen that with the spinach you buy at the grocery store? Right? So he's right, it's much more regulated. That's why it actually is pretty safe to use a cannabis product, a marijuana product, that's gone through that rigorous testing. It's safe. It's a lot more safer than some of the stuff being sold on Amazon. And again, like you said, the full panel, looking at everything, not just the cannabinoids and the terpenes, but the myotoxins, the heavy metals, the pesticides. This plant is amazing at absorbing all of the nutrients and all the toxins out of the soil. So if you've got dirty soil, you're going to have dirty product. You can remediate a lot of that stuff, but it's why do that when you can just start from the beginning and do it right. So look for GMP certification, look for GAP, Good Agricultural Practice certification. You're now even going to start to see USDA organic certifications, right, because they've now come up with their own rules and regulatory. Now, mind you, from us at the manufacturing and the farming side, it's a little pain in the butt, right, because they just changed the rules, right? For instance, we used to be able to source from the middle of the plant when we were going to test the flowers to see if it was the 0.3% THC content. Well, the USDA said, no, we don't want it from the bottom 2/3, we want it from the upper 1/3. Well, that plant at the top, that upper third, is exposed to more sunlight, more nutrients. Typically, that's where you're going to find a hot part of the plant, right? So you may find something that pops up at 0.4, 0.5, 1% THC, and there's your whole crop gone out the door, right? So that's really important. So I hope we do touch a little more on the regulatory and how we all as consumers and manufacturers coordinate to work with the government to develop the new rules and the regulations. Because right now, they don't see eye to eye. They don't. Scientifically, we actually understand there's no difference between cannabis sativa, aka hemp, or marijuana. There's no difference. Really not, other than the chemical breakdown of the plant, how much phytocannabinoids it has in it. Scientifically speaking, it's the same species. But right now, let's look at it like vitamin C. Vitamin C is legal, right? You can get it from an orange, you can get it from any type of citrus plant. It's vitamin C. But the way we get CBD right now, that's why it's interesting to have two different products, right? A cannabis product and a hemp-based product. Why one has to sell in a dispensary and why one can sell in a grocery store, right? How does that make sense? What you're telling me is the CBD from a lemon is legal, and the vitamin C from a lemon is legal, the vitamin C from an orange is not. Right? So that's definitely somewhere where regulators, legal team, manufacturers, and you guys as consumers, just look at the history of the development of the FAA, and that's how we got to go.
So, is there somebody now within the veterinary community that's doing more research and collecting data for this?
Yeah, there absolutely is. There was a study that came out from Cornell University recently, Colorado State University is doing some studies, Florida State University, I think, has also recently released a study. For us, we're looking at partnering with researchers around the world. We talk to people in Europe. Israel is a hotbed of research. They're doing some amazing research out there. We're talking to some veterinarians out in Mexico that are also doing research. So when it comes to the research, it's really happening on a global level. Now, traditionally, it has been very, very difficult for a lot of researchers to be able to do research on a Schedule I drug. There's a lot of loopholes that they have to jump through. They have to get cannabis from a small farm at the University of Mississippi. They've got to, they face a lot of pressure and stigma from their higher-ups for studying a Schedule I drug. But the Farm Bill is changing that, and then also fortunately there are a lot of other countries that are jumping on the research train, so we should be seeing a lot more good clinical research coming out over the next couple of years.
I know that you were talking about being brought up the fact of hemp-based CBD products as well as to cannabis products. So is there much of a difference in effect in those two different products? I mean, have you found that to have any variance on the health aspects for the animal when using either or?
Well, there's lots of differences, but it's not just the difference between cannabis and hemp, but the difference in the individual product, because, you know, every one of these products is going to have, it can be an isolate, which is just CBD, so you've got a vehicle and just CBD, or, and I'm an advocate for full spectrum whole plant medicine. So if you take the plant and you squeeze it, and you take everything that's in there and you put it into your product, you're going to get a much different results and a more effective result. And so depending on the plant you squeeze, you're going to have different types of ingredients and different proportions of cannabinoids and terpenoids and all the other active things. So while there is the biggest difference between cannabis and hemp is basically the THC level, aside from that, you can get a wide variety of different types of products from hemp, and you can get a wide variety of different types of products from cannabis. It really just depends on what's in there. And, you know, from a medicinal standpoint, the way to know for sure what's in your product, whether it's cannabis-derived or hemp-derived, is to look at the certificate of analysis, the COA, that tells you exactly the milligrams of each cannabinoid and every other active ingredient in there, and that's the way you know for sure what you're giving to your pet. And then you can gauge the results based on what you're giving. And if you need to tweak it or change the ratio or try a different ingredient, then you can do that.
Has there been anything that's come up for certain pets that are on pharmaceuticals and then mixing it with CBD and or cannabis products? I mean, have they found any negative reactions, or have there been any positive benefits?
I think there's probably both. One thing that, and anyone who starts to learn about CBD will learn that CBD does have the potential to interact with other medications, and that's, you know, across the board. I don't think clinically we're seeing a huge issue with that at this point in veterinary medicine, because we're not using super high doses of CBD, but the potential is always there, especially if you're using drug combination polypharmacy. You've got an older cat that's say on 2 different seizure medications, and then you add CBD, there's absolutely the risk that you're going to either have them interfere with each other or change the levels of production. So it's super important when you're combining CBD with other medications to have your veterinarian monitor your pet's blood work and make sure that you're not seeing adverse effects.
So then if your pet is taking a pharmaceutical, then it'd probably be best if they did a full spectrum product, correct?
A full spectrum cannabis product? I mean, I always say yes to that question. And there are very specific examples where I'd say use a CBD isolate, but yeah, I would say in general yes. But depending on what your pet is on. I mean, I would always advocate before you start any product for your pet, talk to your veterinarian, let them know, even if they're not helping you in this process, they should always know that your pet is on this, because that could potentially interfere with anything else that they see them for. And especially if you've got an older pet, always have baseline blood work done if you can before starting, so that if you see any changes, you know, there's been a lot of talk about liver issues and using cannabinoids. If you do blood work first and your pet is perfectly normal liver values, and then, you know, 6 months later it's been on a CBD product and maybe you see an elevation, there could be cause for, hey, maybe we need to decrease the dose or try a different product. But if you don't do that blood work first, you won't know, is this because of the CBD or did it exist beforehand? So it's really always a good idea to have some baseline information. And that's just, you know, from a medical standpoint.
So with products, and if you're infusing your pet with either a hemp or a cannabis product, what do you think are some of the best types of infusion for those products that really seem to mesh well with the system? Is it, or is there a tincture or maybe a treat? What are they finding that has been most beneficial?
I would say it really depends on the disease management protocols and what we're utilizing, right? That's why you see different delivery methods, right? And your delivery method is, it's going to change how it interacts with the body, right? If I'm using a topical, if I'm using a tincture, if I'm using a capsule, if I'm using a oral concentrate, these all have different absorption patterns into the bloodstream. And even changing your tincture, am I going to use a medium chain triglyceride? Am I going to use a long chain triglyceride? It that has different absorption rates into the mammalian, metabolic rate. The medium chain is going to go standard metabolic paths, go through your liver, then your bloodstream. Your long chain triglyceride, even if you eat it, it's going to push into the lymphatic system. You have a higher uptake into the lymph system. Now, that's not going to have much benefit, though, when it comes to epilepsy treatment, because you don't have much blood-brain barrier. You have that break between the two of them. But now, for pain management, for lymphatic disorders and cancers, yeah, that LTC might be a more effective method than an MCT. But again, it goes back to, is one more superior than the other? Not necessarily. It just comes down to, what am I using it for? And that's actually where, working with Beth and Tim and other veterinarians, these become good adjuncts. They do not replace veterinary treatment. I'm not a veterinarian, and I will never tell a client, do what I tell you, or Dr. Google tells you. No, that's really bad advice, right? Talk with your medical professional, and look, okay, am I trying to work with arthritis? Okay, is it rheumatoid arthritis or osteoarthritis? Doc, is there any data for either of those? Actually, there is. It's beautiful. Quite frankly, guys, there's 36,000 clinical studies that have been done on 32 different species. Remember, anything we do before we do it with the humans starts with animals, right? As you said, right, it's about 20 years behind where we go. This is how pharmaceuticals happen, right? First it starts out in your lab, then it goes to the humans, and eventually it makes it back to the companion animal. It always does this loop. I don't know why, it just always has, right? Maybe it's the money, I don't know. But that's just when you look at the history of it, it's how it's always flown, right? And that takes us being involved, right? Doing the research, working with the clinicians, but there should really not be a difference in delivery just on what you need. That's my opinion.
So for the clinicians then, what do you find are been beneficial for the pets to have, that what symptoms and causes are really helping with the infusion of cannabis, CBD or cannabis products?
Yes,